The Health Services Hub was set up in 2012 to help bridge the innovation gap between the university and the health and care sector. The aim was to provide a new route to translate research into practice. This was in response to changes in national, regional and local policy, and the availability of innovation funds. These funds encourage academics and those working in the sector to work together to demonstrate the societal and economical benefits of their work. 14 innovation hubs were formed to help build a series of bridges between the widest range of sectors, building a strong network for collaboration. The Health Services Innovation Hub was dedicated to improving patient care using technology and data. It also took a step towards building a new bridge with Leeds' third sector, working with other hubs to leverage additional support. Reports and research written by experts had shown that the valley of death for innovation was a real problem, and everyone was asking for help to save these important projects. The hub led conversations with partners and interested parties to find out what would help in Leeds. Each world had a perception of the other that wasn't terribly helpful. Working with such big and complex organisations as universities and the health system felt an impenetrable forest to many prospective partners. It was up to the hub team to welcome collaborators into the university and to show them the wealth of expertise and exciting opportunities which lay behind the facade. It was also important to help bring together passionate people who are on a mission of exploration and who want to improve people's lives, namely academics and people working in health and care. The hub helped to cut new paths with collaborators to build clearer routes to partnerships, to build better understanding of how health services work, and to show how mutually passionate academics and sector partners are about helping to make people healthier. Signposts also help to show how all the systems fit together to make things happen. The hub helped to co-create the conditions where university and health and care partners could meet on level ground and discuss areas of common interest for the benefit of people who need care the most. The team adopted a two-pronged approach, building links, exchanging ideas and opportunities from both ends of the bridge. They brought people together who had a burning question and wanted to collaborate to find some answers. Over the 3 years, the hub has worked on more than 100 projects, all of which have forged new relationships and required the health sector and the university to work together to build innovative new partnerships. Building on firm foundations of strong relationships for mutual benefit has been core to the hub's success. There's the Carers Leeds project, which included innovative workshops where rapid prototyping, usually used in the aerospace industry, was used. Design students worked with carers of people with dementia to quickly come up with tech solutions to make their lives easier. More research came out of this, along with a digital tool idea and a new product for those with memory loss. Then there's QTool, an electronic questionnaire builder helping people with cancer to get more involved in their care. Researchers developed it to assist people in giving digital feedback. Now, QTool is being rolled out across Yorkshire and the Humber and is being used by other health researchers around the UK. The mHealth Habitat is an exciting NHS project, building digital use in Leeds health and care systems from the ground up. This fast-growing digital health project has worked with the hub team, building research and development linkages and funding bids with its director, who is also a PhD student at the university. Leading experts at the university have helped to build a new academic support network for the mHealth team. In all these projects and more, the hub team have been central in linking the right people up. The team have helped deliver innovative projects, support engagement work, and leverage funding for the most challenging areas of informatics and digital development. The hub has been a single point of access for people in both worlds to find out about the other, and has worked alongside partners to deliver health impact to where it is needed most, in digital and informatics today. It has linked the right people up quickly and identified innovation gaps and questions that needed answers as a priority. And the Hub team have always been creative, innovative, eager to find new ways of doing things and making sure everyone had the right tools to cut new paths. Over the years, they have built many more routes onto and off the bridge. It is flourishing and full of traffic going one way and the other, with many visitors to the projects, sharing learning as they grow and develop, close and move on. Now things are changing. The bridge is built, but the Hub may not be around to help people on and off it. How are we going to keep the connections? How are we going to encourage others to work in collaboration? How are you going to maintain the bridge? Because this has been built for you to use.